Hi, I'm here with Narissa Bauer, MD. She's an assistant professor at the Indiana University School of Medicine. She's going to be speaking at the upcoming 7th annual meeting of APSARD, the American Professional Society for ADHD and Related Disorders, this coming January 15th to 17th, 2016 at the Mandarin Oriental Hotel in Washington, D.C. She's going to be speaking on a topic entitled ADHD Group Visits for Pediatric Clinics, a new way to engage families in chronic care. Narissa, can you tell us some of what you'll be talking about?
Thank you, Jonathan. I'm really excited to be part of this conference. I'm going to be sharing with the audience our model at Indiana University, which uses ADHD group visits for chronic care management of pediatric ADHD. The reason that this is important is because prior to us starting this group visit model was that families oftentimes did not routinely get to the clinic for a routine checkup on how the child with ADHD is functioning, and obviously they needed to be seen in order to get refills of their medication.
And this would be an individual visit you're talking about.
Right. So the traditional way in which families would get ADHD care is to have individual visits with their pediatrician for 15 to 30-minute blocks of time. And so what we wanted to do was transform practice, not only re-engage with the provider on a different level, but also to engage the family unit in their ADHD care by coming up with a very innovative group visit curriculum. Myself, I'm a behavioral pediatrician and child psychologist, designed an ADHD group visit curriculum where we would invite up to 6 to 8 families to come to the clinics and spend 60-minute in-group discussion. Parents were in one group, the children were in another, and they will run concurrently in different spaces but in adjacent rooms. During that time, the curriculum covers things such as what is ADHD and debunking some myths about it, allowing a forum and a safe place for parents to exchange ideas and thoughts, as well as have more time for the pediatrician to cover some educational components. The same was true for the children as well, where the psychologist or a pediatrician could introduce skills and different discussions with the children to begin to engage them in their own self-care, and so that they could begin to understand what ADHD is like and learn skills such as friendship skills, organizational skills, how to talk to parents about their feelings. And then after that 60 minutes, we would regroup the parent and child together so that the pediatrician could then see them individually for checking their height and weight and blood pressure and then refilling medications.
Right, and how often would these groups take place?
Well, the groups themselves would be offered every month, but typically we would ask the families to come at their regularly scheduled every 3-month intervals.
And can you share some preliminary findings from this?
Sure. We did find that families enjoyed the group visit model, so much so that once we got them into one of the group visits, they began showing up more routinely to the clinic for subsequent group visits.
So it really improves the number of visits to the doctor or the clinic that's really recommended for following an ADHD patient.
That's right. And also during those visits, then the pediatrician has opportunity to continue to more closely monitor how the family as a unit is doing, as well as making sure that the medication is helping in the way that it should and make necessary adjustments. So all in all, it was a win for both the providers as well as the families. The families really cited that they enjoyed the support group aspect that was built in, and knowing that they could hear from other parents what it's like to live with ADHD and realize that they really weren't alone.
Wonderful. So you'll really learn a lot more from Narissa if you attend the upcoming meeting of the American Professional Society for ADHD and Related Disorders. Again, that's January 15th to 17th, 2016 at the Mandarin Oriental Hotel in Washington, D.C. Narissa, thanks so much for being with us today.
Thank you.